If you're approaching starting Medicare and you are sick, should you go with Original Medicare or should you get Medicare Advantage? I want to tell you a story about a couple I helped, and it will help illustrate this question, the answer. They're both starting Medicare on March 1st. Hers is going to be based on her initial enrollment period. She's turning 65, and his is going to be based on a special enrollment period. He has continued to work and is going to retire. She is perfectly healthy. He has some serious health issues going on. So I guess the first question is, does the husband and wife need to take the same path, be on the same plans? And the answer is no. There are reasons that it'd be great to be on the same plan, but let's really take a look at what would be important to serve both of their health needs. So they both came in wanting Medicare Advantage. Let's talk about her first. So being that she is in her initial enrollment period, she's turning 65 and she is healthy, she is convinced that Medicare Advantage is the way for her. So what we did is we looked at her doctors, we looked at her drugs, we figured out what is the plan that matches, that her doctors are a network and her drugs are cost effective. Now with her, because she's coming in a special enrollment period, she is going to have what's called a free look that first year, where if she changes her mind and decides she does not like Medicare Advantage, she can go back, or she can go to Original Medicare, get a supplement without being underwritten, no health questions asked, and that is what she decided was the best path for her. Now for the husband, we have a different set of circumstances. As I mentioned, he's past his initial enrollment period, he's coming in under a special enrollment period, and he is sick. So should he go follow the same path as his wife? A lot of the decisions about going Advantage for them was based on dollars. But with him, I try to say, I really want to show you how Original Medicare works that may be a better fit for you in this first year. So the first thing I had to explain is that if he starts with Medicare Advantage in his special enrollment period, he will not have that year free look like his wife, because when you come in under a special enrollment period, you don't have a free look. So what is the concern here? He's dealing with a cancer diagnosis, and if he does not go to Original Medicare now with a Medicare supplement policy, he may never be able to get a supplement because he's going to have to be underwritten, and it all is going to depend on how his health goes. The next thing with him that I was concerned about, what they didn't like about Original Medicare with the supplement was the monthly premium that they were going to have to pay for the Medicare supplement policy. But what I wanted to make sure they understood is under Medicare Advantage plans, if you're in chemo, the way that all the Advantage plans are written for Part B medications, for Part B drugs that you would receive in a facility or at a doctor's office, you're going to pay 20% of that cost up to the max out of pocket. So let's say you don't like the idea of spending $140 a month for the supplement, but your max out of pocket on your plan is $5,000 and you're in the middle of chemo. Chances are you are going to meet that max out of pocket. So that's another thing to think about. And then the next thing, two more things actually, that was important to me that he understood about Original Medicare is that there were no doctor networks. He could see any doctor in the country, anyone who accepts Medicare, whereas with the Advantage plan, we needed to make sure that we found the right plan with his doctors in network. And then the other thing is that in Original Medicare, there's no prior authorization typically required when you need the more serious services or, things to help you with your health. Whereas under Medicare Advantage, if you need the more expensive services after your doctor recommends them as being medically necessary, the managed care company has to agree with your doctor. So there's this additional step. So full circle with all that, what I would recommend to him is start with Original Medicare, get into that supplement, see how it goes for you, get your health, get better, get healthy, and then if you want to try Medicare Advantage in the future, try it then, because after coming in with Original Medicare and later being in it for some time, that's when you will have a free look with the Medicare Advantage plan. So what did this couple do? She went to Advantage and so did he. Now, that's okay. I spent the time, I educated, I made sure that he understood why I wanted him to know about this, but he still felt more comfortable going with Medicare Advantage based on different cost issues and based on the fact that actually he believes he will not be having the treatment that would be very expensive for the year. But again, when you look at the big picture between the two options, these are very important factors to understand. And you want to have an agent that's going to offer you both, walk you through both, and then you decide ultimately what is best for you. And it's not that I don't believe this person will get excellent care under his Medicare Advantage plan. I just wanted him to really understand what he was giving up or what the limits may be in the future by not starting with original Medicare for him during his SEP.